Welcome to a special episode of the Pharma Forum podcast, sponsored by Axtria. I'm Pharma Forum Editor-in-Chief Jonah Comstock, and in this episode, I'll be speaking with Amanjeet Singh Saluja, a principal at Axtria with more than 22 years of experience across analytics and management consulting. Axtria is an AI-first data analytics and cloud software company focused on the life sciences. I'm excited to chat today with Aman about a topic that's perpetually top of mind for pharma, launch success, and how to blend technology and strategy to solve the pernicious problem of underperforming launches. Welcome to the show, Aman.
Thank you, John.
So before we jump in, tell me a little bit about yourself and your role at Axtria.
Sure. Once again, thank you, Jonah, for this opportunity. I have been in the AI analytics and cloud software space for about 26 years now. Earlier I worked a lot in the financial services space and subsequently pivoted to life sciences, where I've been focused on building and scaling Axtria solutions across, our life sciences, our portfolio of life sciences clients. I've been with the firm for pretty much from the start when we were working out of business center. So it's been a great journey so far.
So the industry has spent billions on data analytics and technology over the past decade, but by most measures, commercial launch success has actually gotten worse in that window. How do you explain that gap?
Yeah, I would start by reframing this premise slightly differently. See, the issue is not that the industry is underinvested in data and technology. In fact, the investment has been very significant and sustained. But the real challenge has been that, the market complexity has increased much faster than the way our industry has been designed to operate. So, now we are launching into environments that are far more fragmented, far more access constrained, lot more evidence driven than what it was a decade ago. And at the same time, the internal systems that translate the insights into action, how decisions are made, how teams are aligned, or how execution happens, they have not evolved at the same pace. So, what you see is not a failure of technology, but what you see is a gap that has become wider between the capabilities and the orchestration abilities. That's the challenge that I've seen over the last decade in the industry.
Interesting. So what would you say is the root cause of these underperforming launches, if it's not technology? And what do organizations that are struggling with launches have in common?
Over the last 15 years, we have easily been involved with more than 100 launches, I would say, in the industry globally. And we have seen that the best leaders in the industry understand that the launches are not primarily a commercial execution problem. Fundamentally, they are a system design problem. So we have seen that in underperforming launches, the issue is rarely a lack of effort or a lack of insight. It's far more that your decision velocity is too slow, the accountability is too fragmented, the teams are not operating as a single system. So you often see multiple functions doing the right things individually, but they're not moving in sync. For example, medical is generating evidence, commercial is driving engagement, market access is doing what they're supposed to do, working on coverage, but the integration across these efforts is weak. And we have seen the strongest leaders have recognized that speed and alignment, they are competitive advantages. They simplify, therefore, the decision pathways. They align the incentives across functions. They create a very clear line of sight from insights to action.
This is one of those things that's like easy to say, but hard to really fix, right? How do you build that alignment?
I think it boils down to the commercial model evolving to realizing that, they have to now shift from scale to precision. We are no longer operating in a world where reach and frequency alone will drive success. Patient populations are now becoming smaller as the industry has moved towards specialty and rare diseases. The care pathways have become more complex. The access decisions are becoming more stringent. In fact, in some therapy areas, we have seen that majority of prescriptions now require some form of intervention from the manufacturer to secure access or affordability. So that changes the game.
Yeah.
What needs to happen, therefore, is that the modern model needs to integrate these four elements very seamlessly: the evidence, the access, engagement, and patient support. It's not just enough to demonstrate clinical value now. You have to prove real world impact. You have to support the patient journey end to end, and you have to reduce that friction in access. That is what is needed. which has not happened to the degree it should have happened in the industry over the last 10 years.
Let's talk about that shift that you mentioned, towards specialty and rare diseases, much more complex therapies, much more complex payer environment. How have commercial leaders kept up or not kept up with that change?
So, as I said, what has essentially ended up happening is that individually within functions, a lot of the leaders have come together and said, okay, we need more data, more AI, more insights. We need them faster. But what has not happened is how that orchestrates together to really enable a successful launch. That has been the missing link. So, in my mind, it is a far bigger operating model issue, the silos between functions issue, and the mindset of being able to come together and orchestrate that has differentiated when we have seen a great launch versus a mediocre or an underperforming launch.
Can you give an example of a great launch that's gotten that right?
Unfortunately, I can't go into the details of a particular brand because that's like giving away the secrets of one of our clients. But I can tell you what some of the tenets have been, of what a great launch has looked like. So, for example, actually, this brand everyone knows about. So the brand is Kitruda, which is almost a 30 billion plus brand now. Everyone in the industry knows about it. Why this has been in my mind, a great launch is because it was not a single launch, like one binary event. It was a systematic expansion strategy that Merck put in place. The initial approval, if you go back to 2014, it was just for melanoma. Today, this brand has 40 plus indications across multiple tumor types. And no wonder the revenues, going beyond 30 billion or so. They built a platform of indications and evidence. You see, I talked about how evidence has become very important in today's world. Evidence strategy led the commercial strategy in this case. They did not wait for demand. They actually created what I would call as clinical inevitability. They were, there was very aggressive investment that the company made in clinical trials across tumor types. Their movement into earlier lines of therapy, they really pushed for that early on. And there was a very strong focus on overall survival endpoints, not just, as we call the surrogate markers. Then the point I was bringing about on, how the various functions have to come together, you should have seen how the integration happened across functions. This is what we felt was one of the best in class. The medical, commercial, market access, diagnostic, it was a parallel and a well orchestrated execution across these functions. Medical was driving, the trial design and the KOL advocacy. Commercial was building oncologist confidence and adoption pathways. Market access teams were running hard to ensure there was broad coverage early on. And the diagnostics basically groups were ensuring that they had aligned with the biomarker strategy. It was a very nicely orchestrated orchestration that was done to ensure success of the brand. And the speed with which the brand executed, there was a rapid expansion of the indications of the brand. There was a cadence to that. There was a very strong presence at major oncology congresses, and the data readouts that kept happening continuously kept driving the momentum. You see, that's how they shaped the market.
Yeah, because the speed is money, right? When you're thinking about your LOE clock, right?
Absolutely. Absolutely. And you see, this is not just a one moment of success. It is a sequence of decisions that they executed in sync with speed, with precision. That's what it takes to scale a brand like that.
One thing we're seeing a lot of in the industry is this pressure to cut costs, right?
Yeah.
Offshoring, GCCs, and kind of putting functions together in that way. Headcount restructuring. Are these the moves that companies should be making right now, and are they making them in the right ways?
So, Donna, cost discipline is essential, but I think it has to be approached thoughtfully. What we are seeing across the industry is that there is a strong push towards restructuring, towards global capability centers, workforce optimization, all of that. And all those are right, rational moves in a high cost environment. But I think the key question is sequencing. For example, if you move work offshore without redesigning the underlying process, you might end up reducing the cost temporarily, but it's going to be it's not going to fundamentally improve your performance. You have ended up taking a broken process millions of miles away, where now you are asking people who have were sitting in offshore locations to execute on that broken process. In some ways, you have ended up, I would say, institutionalizing inefficiency. The more effective approach in my mind is first simplify, clarify the decisions, eliminate the duplication, fix the broken workflows, find out what technology will allow you to scale these kind of workflows, then drive these kind of decisions on what's the right location and what's the right structure for execution.
Right. Because if you do it in the other order, you end up maybe getting rid of the tools that you actually need to execute, right?
Yeah, exactly.
So we haven't actually talked about AI yet, and I know AI is very central to you guys at Axtria. But at the same time, right now everyone's talking about agentic AI, and it can sometimes come across as a panacea, right? What would you say to a commercial leader who thinks that technology is going to solve their problems here?
Yeah. See, agentic AI, first of all, let's get that baseline. It has real potential. We are in the space for, we've been in analytics and AI space ever since we started this firm. So we know what is happening right now through agentic AI. It has absolutely real potential to disrupt and change the ways of working in the industry today. Particularly because, commercialization is now moving towards continuous sensing and continuous response time, reducing the response time. Everyone's aspiration is towards that. We're moving from a periodic planning cycle to something which is more dynamic, something which is always on kind of decision environments. Now, in that context, systems that can really interpret the signals and recommend actions and adapt in near real time, they can be very powerful. So the potential is great. But the risk is how AI is being treated as a solution by itself. Look, if the underlying operating model is unclear, if the goals are not well defined, if incentives are misaligned, if your workflows are broken or fragmented, AI will just simply accelerate those issues. It'll make you faster, but it will not necessarily make you better. The real value will come when AI is embedded in well designed workflows. That is when it can improve your decisioning quality. It can personalize the engagement at scale, which the industry is now striving to get to. And it can create tight feedback loops between strategy and execution. You remember we started this podcast by stating that, look, the big gap we have seen is the gap between the strategy and the execution. AI can help fix that, but you have to first ensure that you are embedding it into a well designed workflow. So the question that leaders should ask is not how do we deploy AI, but like what outcome are we trying to change? And once that is
Yeah.
clear, I think AI will be a force multiplier.
I mean, what you mentioned an alignment problem earlier, with all these teams working in silos, and also you talked about scale and the need to move from sort of from a scale mindset to a precision mindset. Are those things that AI can help with?
Absolutely. So, for example, today, if you look at, I'll take an example of rare diseases. The biggest problem of rare diseases is really finding the patients, the right patients. You need to be a lot more precise. Where am I going to get the patient population from? And therefore, which KOLs or which HCPs I need to be influencing early on. It's a precision problem. It's not a scale problem. You're not looking for millions of patients. So, absolutely, AI can help you drive the precision in your go to market strategies. It can help you bring the orchestration across various functions together. See, the thing is, as I said, the alignment challenge in our industry is not that teams are doing the wrong things. They are doing the right things, but they are not doing it in a coordinated way. So, for
Yeah.
example, and it is this fragmentation which shows up in the poor decisioning velocity or poor decisioning quality. If insights don't travel fast enough, if actions are not sequenced properly, if teams are reacting to the same signal differently, what do you think will happen? It'll be poor orchestration, resulting in a poor launch. So, as you are moving from scale to precision, you basically, AI can genuinely help you by first, it synthesizes your signals continuously. It creates, a single evolving view of your so called patient journey. So all teams can react to the same reality, not to different versions of truth. And then the orchestration, AI can really help in the orchestration powerfully. Like, what is the right sequence of actions that need to be taken across functions? How do you coordinate what a rep is doing versus what your MSL is doing versus when the access interventions are needed? or what patient support programs need to do. Today they tend to be isolated actions. They can be a connected journey through AI. So it's very powerful in executing some of the things that we discussed have been the challenges so far.
Let's try to summarize the key takeaways from this discussion as we get towards the end of our podcast. So we talked a little bit about, we've been talking about sort of like what's going wrong with these launches, how to fix it. We talked about how it's a strategy problem, it's an alignment problem, and technology, it can help, but you have to use it right. How would you sum up the discussion in a couple of bullet points or takeaways for folks that really want the actionable insights here?
Yeah. So I would say that if I had to summarize, I would say one thing, that fundamentally nothing is broken in the launches. But what is broken is how the system operates. And three things are happening today. The complexity has increased very sharply, but the organizations are still operating in silos. And therefore, decision making is too slow and fragmented. And to fix that, we don't need more activity. We need better system designs. And three shifts will matter here. You need to move from execution to orchestration mindset, which means having a view of end-to-end journey orchestration has to be one of the starting points when we are executing a launch. You need to move from a mindset of scale to precision so that we are able to contextualize and have dynamic interventions across that patient journey. And you have to move from fragmented ownership to what I call as aligned systems, where your speed and alignment become essentially a competitive advantage. So you have clear decision rights allocated, your incentives are aligned, and you have a single thread moving from insights to decisions to actions. That's what I believe AI will enable for all of us and help us basically turn around this cycle we went through where our launches have not been succeeding in the last few years as much as they used to earlier.
Well, thank you so much, Aman. This is really a fascinating conversation, and I think a super useful one for our listeners and our Pharma Forum readers in the pharma and biotech industry. So thanks so much for sharing your expertise and your time with us.
Thank you. I appreciate that once again, Jonah.
That concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments, at pharmaforum.com/podcast. The Pharma Forum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your podcasts. Just search for Pharma Forum and follow and hit subscribe. Of course, don't forget to visit the website itself, where you can sign up for daily and weekly news and analysis bulletins, and follow us on Blue Sky and LinkedIn at Pharma Forum. That's PharmaPhorum. That's all for now. Thanks for listening.